away from the Women's Day celebration to our global coverage of the coronavirus pandemic. In Rivers State, doctors have expressed optimism for the future as more frontline health workers around the country prepare to receive the COVID-19 vaccine. The doctors, during a meeting, pledged to support the vaccination program, which is aimed at curtailing the spread of the virus. And correspondent Uche Okoro reports.
Last week, Nigeria took delivery of nearly 4 million doses of the AstraZeneca COVID-19 vaccine. The first category of recipients are frontline health workers, like those manning the COVID-19 Isolation and Treatment Center at the Rivers State University Teaching Hospital. For doctors, the expectations are high as the number of positive cases in the state approaches 7,000, the sixth highest in the country.
When the COVID-19 vaccines get to us here in the Rivers University Teaching Hospital, all residents are poised to take in the vaccine. And because we have been seeing the cases, we have been seeing the people come down with COVID-19. Some of our colleagues actually developed COVID-19, haven't contacted it from patients. Okay, therefore, there is no resident who will say, no, I don't want to take the vaccine. I can assure you that all resident doctors want to take the vaccine when it gets to us.
Despite the commencement of Nigeria's COVID-19 vaccination program, the Association of Resident Doctors welcomes the development with cautious optimism. It wants the government to sustain research targeted at protecting the more vulnerable groups in the society from contracting the virus or the dangers associated with it.
For instance, in the obstetrics and gynecology department, there's interest at this point in time, to go into what are the likely way, a pregnant woman, for instance, might manifest with COVID-19 symptoms. We want to know that. What will be the effect of drugs, taken by a pregnant woman, that has COVID-19 symptoms? Okay, these are some of the things we want to do. And what is even the prevalence of COVID-19 among the pregnant population? These are areas, that people in the O&G department will want to go into. Of course, for those in internal medicine, surgery, they have so many other things, they want to look at.
The association also resolved to carry on with its demand for facility and manpower upgrade until all departments of the Rivers State University Teaching Hospital are accredited. They say this will improve service delivery at a time of increased pressure on the health sector caused by the global pandemic. Uche Okoro, TVC News.